Thanks for listening to the Granite List Live. Today's episode is brought to you by Connect Healthcare Collaboration, where benefits marketing meets clinical advocacy to drive effective employee engagement. This is the Granite List Live, where we explore all things human capital and employee benefits related. I'm your host, Sally Pace, and today I am joined by Kristen Nicholson with Comfort Imaging. Kristen, thanks for being here.
Thanks for having me. This is exciting. Thanks a bunch.
Well, the work you're doing is so important, and so I'm really excited to share your story. But before we dive into that, will you tell us a little bit about you?
Yeah, of course. So my name is Kristen Nicholson. I live here in Nashville, Tennessee, and spent a little over 20 years in corporate healthcare before taking the leap into entrepreneurship back in 2020 and opened up a wellness studio that I still own, turned it into a franchise. We have 13 locations nationally. And then about a year ago, a former colleague of mine came to me and introduced the technology that we have at Comfort Imaging through Koning. And ever since then have been going down the journey of starting a new company and bringing a new technology to the masses and really focused on women's healthcare.
So let's start by just talking about Comfort Imaging itself. You've got facilities across the country. And so kind of start a little bit with that patient experience. What can someone coming to see you expect?
Yeah. Well, I mean, the first thing that women can expect is a quick appointment. We purposely keep our appointments a little longer so that it is private when you come in. I think we all, if we've had a mammogram before, we all envision, I've got to go to the hospital. I've got to park in this garage. I've got to figure out where it is I'm going. I'm going to walk down this long hallway. I'm going to sit in this waiting room that feels a little icky, right? And then I'm going to go and have this experience that I'm not looking forward to. Maybe I'm afraid of, maybe I have breast tenderness already, and this is not going to be comfortable at all. And so all of those ideas are thrown out the window in your experience with Comfort Imaging, because we can get you in quickly. A lot of times, if you have to have a diagnostic mammogram, you may wait up to 6 to 8 weeks in some markets. I know here in Nashville, there's a little bit of a backlog. And it's terribly hard to get to the facility to go to do it. So when you come in at Comfort Imaging, it's really straightforward. You know exactly where to go. You come in, you answer a 10-question questionnaire. We get you changed. You're the only one in the waiting room. Our staff walks you through the whole process, answers any questions that you may have before, understands whether this is your baseline, this is your first mammogram, or if there are any areas of concern for you. We take our time with that. We make notes about that for our radiologists to read. And then we walk you through the exam. Our Koning equipment is a table that you lay on, and it's all gravity based. So if you think about your annual mammogram in the past, you went into a room, maybe the tech felt a little hurried, maybe they were running behind, you're standing there in this paper gown and you're having to expose yourself and experience something really uncomfortable. This is totally different. You've got your lush robe and you lay on the table. And because it's gravity based, the images can come all the way back to the chest plane. And that's something that mammography has not been able to experience before. And so a lot of little cancers really hide in that last inch that you can't get in that mammogram when you're being smashed in between those two plates. No one touches you. The tech will say, maybe move a little to the right, move a little to the left. And then each scan of each side of your breast takes 7.5 seconds. So the total scan takes 15 seconds from top to bottom. And it is a true 3D view. It's a 360 look without having to do so many different presses. When you think about your traditional mammogram, there maybe was a top to bottom and a diagonal. And if they see something, they may want to get one extra little spot. So sometimes you get compressed maybe 3 to 4 different times if there are areas of concern that they need to look at. One, that's uncomfortable. 2, if you have any breast tenderness, it's really uncomfortable. And if you have implants, it's even more uncomfortable by the way that they have to move the implant to get the image. And then from there, you're done with your scan. You ask any questions. We see that at a lot of people's first visit, they have a lot of questions in regards to, who reads it and when we'll get the results back and how does this differ from and that sort of thing. So we take our time with each individual patient and answer those questions, make sure they're comfortable. And then they're on their way out the door. And one thing is I overhear, of course, I'm not a tech, but I am there in the office. And I hear patients say, wow, is that it? Or I took the whole afternoon off. What do I go do now? And, and what a treat it is to hear that, right? It's not, and for a lot of these ladies who have been afraid to have these scans in the past, it's really refreshing that now they can be proactive in their healthcare without the fear of whatever it was that was keeping them from doing it. Unfortunately, for a lot of these ladies, it's been a fear for them not to go get a mammogram. And so there has been a place that has been of concern, and they're finally getting clarity on what that is. And that can be scary too. And so we really take our time with each individual guest as they come in.
So I want to dig into the technology a little bit, because it's kind of crazy that mammography has not advanced when there have been so many other advances in modern healthcare. That's one area that really seems to have lagged. And so I'm curious, as you've brought this technology into the marketplace, how is it being embraced by the medical community?
Yeah, I want to first and foremost talk about how long it's been since we've seen any advances. I'm going to date myself now. 25 years ago, I built a women's imaging center here in Nashville with one of my colleagues. And I was talking about it being the latest and greatest in women's healthcare. And at the time it was new. And I remember having a conversation with these physicians, and they were like, I don't know, we got to keep doing what we're doing. And I said, no, I think this is the way of the future. And at the time, it was. It's now what we call traditional mammography. And so now here I am, I find myself having these conversations with physicians, the same physicians again, and saying, this is the latest and greatest. And they're like, yeah, Kristen, you told me that, 25 years ago. It truly is. You're exactly right. It's archaic. It's been 25 years since we've seen any sort of advances. But I think what's interesting is you look across the hospital systems across the country, 2026 really as a start is thinking about a real focus on women's health. And I think that's for a couple of reasons. One, knowing that there had to be a difference that was made. Two, knowing that 4 out of 10 ladies were not getting their own mammograms because of different reasons, that there was a real barrier in the testing, and knowing that there needed to be other options. And three, knowing that women are the ones that are making decisions for their families in healthcare. And so if we can open it up and be a little bit more inviting and supporting our ladies, then there's a real opportunity there. For the market, it's been interesting. It seems like the consumer and our guests are the ones that have known about this and have been looking for this for years. And they've been waiting. They had heard this technology existed, and they were just waiting for something to be a little closer to them. I think about the distance that our guests travel to us. Last week we were doing scans. We had somebody in from Oklahoma City, somebody in from Boston. These people that are flying to us because they know this technology exists, knows that's where the best image quality is coming from. So the consumer knows, but it sometimes takes a little longer on the physician education side of things, especially because this has been a little bit different. We do require an order for this. Now, your typical annual mammogram, physician doesn't need to write an order. So we've gotten a lot of pushback from that. They're saying, why is it that you need an order to move forward? And the answer is because this is a breast CT. It is a CT scan. But that's what provides the really great quality of images too. If you think about a CT scan, it comes in slices. And so you're really able to get down to real detail. So much so that some of the images that we see ribs. It goes all the way back to the chest plane. And so the clarity and the image quality there is second to none. I've never seen anything like it. And so what does that mean then? That means that we're able to catch smaller cancers earlier and to call out any areas of concern years earlier than you would on traditional mammogram. Unfortunately, or fortunately, depending on how you look at it, I've had friends of mine who are, I try to get to come in and they say, oh, I've had my traditional mammogram already. And I say, hey, well, we just need to do some extra scans. Do you mind if you come in and experience? I'd love to have your feedback. And we caught things that their traditional mammogram came back all clear on, weeks before. So I think the technology is there. It's going to take a little bit more time on the physician education side of things, but we work with a really great group of radiologists who do a lot of education themselves at these different meetings. And I think the more that consumers are talking about this and going to their providers and saying, hey, this is the place I'm going to go this year for my mammogram. I need an order, and this is what I'm going to do as a choice, and advocating for themselves. I think a lot lot more physicians are becoming open to it. And then certainly as they send those orders in and we send back the results and the reporting and how to work with our radiologist on the next steps, the physicians here locally have been just blown away with the attention and really the white glove service that has been given from Comfort Imaging. So, if I've gotten my first order from Dr. Jones, then after that, now Dr. Jones is sending all the time because they've had such a great experience. It's just that first one sometimes can have a lot of questions to it. And that's totally understandable within new technology.
And what about nationally?
Nationally, we're seeing more of these equipment in these centers pop up. So you may see them in conjunction with other services that are related to women's health, whether it be traditional mammography, also in the same center, and ultrasound and biopsies and other diagnostic imaging services as well. At Comfort Imaging, we only have the Koning equipment for the breast CT for the mammography piece of services, but we hope to be adding more soon. There are a few other centers across the country that are like ours as well. There's one in Dallas, and there's one that just opened up in Seattle also. So we're seeing it a lot grow a little bit slower here in the U.S. than we are across the country, across the world. If you look up koninghealth.com and you look at their locations, you see it's pretty heavy presence in New Zealand and in Europe and things like that right now. So they're having a quicker adoption of that. We know here that sometimes it takes a little longer to steer the ship when it comes to pulling in either cash pay, just letting the market know, and or pulling in on the insurance world of things too. It's just going to take some education.
So you just brought something up that is top of mind to me, and that is cost. And so can you talk through the logistics of that? Or is it cash pay? Is insurance accepted? How does that work?
Today, if you were to call Comfort Imaging and schedule a breast CT, we don't accept insurance today. It is a charge of $450. Now, what we can do is we can provide a super bill and you can submit that to your insurance to see if they'll cover for it. We haven't seen anybody do that yet, so we don't know, what the likelihood of success is there. We have seen a lot of ladies use their HSA and FSA funds to be able to pay for that. And then we just started getting contracted with an insurance navigator who's going to start writing our carve-outs and negotiating with insurance companies. We are expecting probably in the first 30 days to see 1 to 2 commercial plans pop up that they have already been contracted with other like type facilities who are seeing this service and reimbursing for it. And then surely within 90 days, we'll have some of Middle Tennessee's, the top 10 commercial payers. What we're really interested in is getting in with Medicare and things like that. But we just know that it's going to take a little bit of time. I mean, we've done this before, and with any new service, it just takes a little bit of time. But we've got a lot of great traction talking with our payer friends, all of us that are involved in the administration and operation of Comfort Imaging have a big payer past. And so it's easy to call on our friends and say, where do you think we are in this? But to answer your question, it is all cash for now.
And you mentioned Medicare, but tell a little bit about the audience you're seeing. What ages are coming to the facility?
That's a great question. I have really been surprised at people that are 30, 35 that want to come in. Now, those might be ladies that have breast implants and they, want to check and see if there's any sort of leak or anything like that, or they think that there might be a problem and they're just advocating for themselves to come in and get a scan. I've been really surprised by the age group of people. Maybe they had a history or something like that. I think a lot of that has to do with the population today. You see a lot of people turning to concierge and functional medicine. And so they're taking a deeper dive into different illnesses and, why it might be there. And so I think they're being more proactive. I think consumers are smarter than we were when I was their age, again, dating myself. But then certainly 40 to 55 is the biggest bulk of people. And we're seeing those people come from across the country, and people will travel to come in for this. Of course, in Nashville, you can make a weekend out of it. So as you can imagine, our Fridays and Mondays are quite heavy on scan day, and offering Saturdays to be able to add that in for our tourists that come into town. But, what a great thing to do for yourself. I'm a big advocate in proactive healthcare. I think we've all seen the Band-Aid that sometimes it feels like, and the reactivity that we see in healthcare today. And when we look at something like this and we look at people really taking steps to be in the know and have information and be data driven is really exciting to me. I think it's a really cool time in healthcare.
Well, Kristen, we are at the Granite List are so excited to be able to share your story. It is a great time to be in healthcare, and you are at the forefront of technology that is changing a rather archaic process. So on behalf of women everywhere, let me thank you for that. And thank you for allowing us to share your story today.
Absolutely. Thank you for having me, Sally.
You bet. This has been a great episode. And so I'll close out by letting those listeners know that obviously we feature comfort imaging on the Granite List. And thank you for tuning in to another episode of the Granite List Live.
Thank you for listening to this episode of the Granite List Live. Access our entire library by visiting your favorite podcast venue or subscribe on our site, thegranitelist.live.